If you suffer from dizziness, vertigo, or balance issues, maybe it's coming from your neck. Maybe that it's the food that you're eating, or maybe that you're not getting the right supplement. In this video, I'm gonna go through exactly what are the foods that could be causing vertigo, dizziness, or balance issues. I'm gonna even give you a bonus at the end of this video, which is what supplement that you should be taking, and an added bonus, 2 exercises that you need to try in order to get relief at home. I'm Dr. Matthew Posa, and I'm a chiropractor in Milton, Ontario, Canada. I help people get over their health challenges and live the life they were designed to live. If you want more content on health, tips, and tricks, then subscribe to my page, because every week I'm gonna release more videos that's gonna help you live the life you were designed to live. So don't forget to like, subscribe, and share this information with the people we know need it the most. There are 3 foods that you need to avoid when you have vertigo, dizziness, and even just being out of balance. And these 3 foods, what it boils down to at the end of the day is it comes down to inflammation. See, inflammation or causing a pro-inflammatory response within your body. So whether or not it affects the inner ear, whether or not it affects your neck, whether or not it affects other organs, a lot of the times, certain foods that you take in are causing a pro-inflammatory response, meaning it's causing inflammation, and it can make things even worse. Also, if you do have some other underlying conditions, other things that could be causing health challenges, autoimmunity being one of them, then these foods can amplify or make it worse. And the first food that you need to avoid is gluten. By now, most people have heard of gluten. Most people understand that gluten isn't good for you. However, most people think that they might not be affected by it. Now, gluten heavily tied to wheat, but also any type of grains. These are the foods that you need to avoid. So we're gonna look at removing pastas from your diet, breads. You want to start making the shift where you're removing this out of your diet. Now, when you remove this out of your diet, 2 things are gonna happen. Number 1, you're gonna notice less bloatiness, less inflammation, but then all of a sudden, your vertigo can start to change. Why this is important is because the inflammation that gluten causes is very deep. It affects your gut. And studies have shown that when you do take on wheat, it causes a very temporary, a very short period of leaky gut syndrome. And this really messes up not only your gut, but how you absorb nutrients and how your body processes your food. So gluten itself, especially in North America, especially since it's been genetically modified, is a lot stronger these days, but our bodies have not adapted to it. And therefore, most people do have some kind of reaction to it. Whether or not it's causing the full-blown vertigo or dizziness, or contributing to it, the fact still remains the same. Remove it from the diet and see if that is affecting you. There is a high probability that it is. The second thing that you need to remove from your diet is going to be milk products. In particular, we're talking animal or cow milk products. The reason why we're removing milk products is not just lactose, being something that a lot of people have a hard time digesting. So again, we're going back to the gut and how that affects you. But the other one is it mimics gluten. It mimics it. So there's a lot of people who come off of a gluten diet, but they still take on dairy. And the moment that they take on dairy, they're noticing that they're not really getting anywhere. It's still not affecting them the way that they want to. So when you remove dairy, you make that other leap, then what ends up happening is you start to notice that now you're getting the effects. And me being in practice for over 12 years and seeing hundreds, if not thousands of people with this condition, the moment they've made these dietary changes, we've seen a massive change. And we're not just talking about things like dizziness or vertigo, we're talking sometimes associated things, whether it's Meniere's disease or other types of conditions that cause balance issues or even cognitive issues. We're noticing that people's memories are starting to come back, that their brains are getting a little bit stronger. So we know that it affects a lot of different parts of your body, so I would make that change. And the last thing you need to remove, no surprise here, is going to be sugar. You need to remove refined sugar from your diet. So refined sugars, obviously chocolate bars and candies and things like that. But I want you to keep in mind, Sugar, whether it comes in the form of cane sugar or agave syrup or whatever, sugar itself also is in fruit. Fruit is high sugar. Even things like carrots have sugar in it. So if you're doing fruit juices at home, then what you're doing is you're raising your blood sugar levels, and then it becomes an insulin problem. So at the end of the day, the reason why we're saying sugar is because what we're trying to do is control insulin. And insulin, with more and more research around this, is we're seeing that it's affecting so much more. And in fact, in the next couple of years, we're going to get even more clarity around insulin, because there's a lot of people who have dizziness and vertigo that actually have an underlying insulin issue, but that goes undiagnosed. And then if you take the sugars, you're doing, let's say you're taking in a lot of fruit. I'm not saying fruit isn't good for you. I'm saying there's sugar in it. So you have to be mindful of how much that you're eating. And sometimes when you're eating it, I would not eat it before bed. I would not be drinking a full glass of orange juice or any type of juice for that matter, because all you're doing is you're taking in more sugar. And then you're spiking your blood glucose levels, and then in fact, then you're making it really tough for insulin to do its job. And the last thing I would do to really help support this whole thing is start making some little lifestyle changes. And one of those would be eating habits. And I would look into something like intermittent fasting. This video doesn't go through that, but I would definitely look into intermittent fasting. It's a conversation, especially if you do have insulin issues, if you're a type 1 or type 2 diabetes and some other conditions, you do need to check with your doctor first. So please do the work, go see your doctor, ask them if you could get this checked, and ask them if it's safe for you to do intermittent fasting. So in the comments down below, let me know how that works for you. Try this for one day, see if it makes a difference. If it does, then go to 2, then 3, then 4, then do a week. A week of eliminating these things from your diet. Let me know down in the comments below how you did, how it worked for you, whether or not it made a change. But this next thing I'm going to give you, and here's the next bonus tip, is going to be what research has found to be one of the things that is missing from your diet. And one of the supplements that not only helps your entire body, because it is one of the only things, or if not the only vitamin that your body makes, which is vitamin D3. Vitamin D3 is incredibly important. It plays with the hormones, it plays with your body, it is part of almost every process in your body. But in particular, those people with dizziness or vertigo that are coming from the inner ear. Now there's crystals in those inner ear, and those crystals are made out of calcium. So one of the things that we want to make sure that you're doing, because vitamin D helps calcium, it makes your bones get stronger, it prevents diseases. But the thing is, vitamin D in combination with something called K2, which is another vitamin. So vitamin D3 and K2, when they're combined together, K2 allows for calcium to be absorbed, not into tissues, but exactly where it needs to go. So it goes back into the bones. So if you have free-floating crystals inside your ear and you're doing the Epley's maneuver, and by the way, I have a different way of doing that Epley's maneuver, especially if you're noticing it's hurting your neck. So make sure you watch that video right here. But I would do vitamin D3 and K2, and I would up that dosage. I would be taking at least 4,000 to 5,000 IUs of vitamin D3 and around 480 micrograms of that vitamin K2. I would be taking this daily until I start to notice those changes. In recent literature, it has highlighted the association between low vitamin D levels in K2 and the presence of dizziness and vertigo. So I would make sure that you're at least covering your bases with that and check that. Now, if you're not sure about your vitamin D levels, personally, if you have enough or not, then I would go to your family doctor. I would go get a blood test done to see what your vitamin D3 levels are at, just to make sure that you're in the safe zone. And my last tip that I'm going to give you today is going to be around what you can do right now at home. So there's a few things that affect the inner ear, that affect your neck, and that really contribute to vertigo and dizziness. And the first one is going to be these muscles in the front of your neck. This is called the SCM muscle, and then you have your trap muscles right here. Now the SCM often is related to vertigo and dizziness. A lot of people who've had accidents or falls, whiplash type of injuries, often do suffer with vertigo and dizziness. And so this muscle is a major contributor to it. So at home, all you want to do is you want to look over one shoulder and you want to arch back. So from the side here, I'm going to arch back if I'm doing my right neck, and I'm arching my head over. And then what I'm going to do with my hand is I'm going to stabilize my shoulder. Now when I stabilize my shoulder, what I'm doing is I'm stopping myself from twisting or turning as I turn my neck. There's a high probability that a lot of you at home that have these issues, that the neck is actually the source of it. And therefore, when you're doing too much of this movement or too much, or you're not actually able to turn your neck. And so what you want to do is you want to go as far as you can. You want to arch your head back, and I'm holding down here to make this almost tighter. And I'm going to hold this for about 10 seconds. If you could do this 15, even better. And you're just going to hold that, breathing through the whole time. And then you're going to repeat that on the other side. Again, use your arm as a stabilizer, and then you're arching over, looking over your shoulder, looking over the shoulder. And that way you're going to get that relief. The other one that you're going to have to make sure you're doing is the suboccipitals. Now the suboccipitals are the muscles that are right here in the base of your skull. Now these muscles protect the atlas bone, the top bone right here. But what happens is if this bone is shifted any way, if this bone is rotated any way, if this bone is tilted the wrong way in any way, these muscles are at play. They're going to be trying to stabilize the area. But that compression is causing inflammation on the nerve. And that inflammation, because of the area that it's close to, which is the visual cortex right here. So this is where your brain processes vision. So this is why, if let's say you're on your phone, you're looking down and you go to look up, some people get a little bit dizzy. There's an eye association, and there are some eye exercises to do, which will be in another video. But today what we're going to do is we're going to work on the muscle. So what you're going to do right in here is you're going to take your head and you're going to bring your hands on top, and you're going to tuck in your chin like so. So you're tucking in your chin, your elbows are in front, and all you're going to do is bring it down. Now as you do this, you're going to feel a deep stretch in through the back of your neck, but you only want to go as far as you can. If the vertigo is coming from, or dizziness, if it's coming from your upper neck, your upper cervical spine, then you need to make sure that that gets stabilized. Make sure you're going to see a corrective care chiropractor, get that area under control. But these muscles right in through here are going to be hyper. They're going to be tight. They're going to be sore. So what you want to do, you want to be super easy. I wouldn't rub them too much. You can if it gets you a little bit of relief, but really the stretch, pulling your head down, tucking in your chin. So we're going like this and then like this. You're going to get that nice stretch in there. And then if you notice that one side is a bit tighter than the other side, then what you could do is focus a little bit more on that side. So if I want to do my left side, I'm going to take my right hand and I'm going to pull this way, like this. So now I'm lifting this side. If I notice that there's more tension on this side, I would just repeat on the other side. And so you're using your hands, you're using your arm weight to be pulling that down. I want to know how you're doing with this. So please leave a comment or question down below. If you need more help on vertigo or dizziness, I made another video which you can watch right here. And don't forget to like, subscribe, and share this information with the people we know need it the most.